Hey everyone, I'm starting this vlog. I kind of want to document my journey through being diagnosed with cancer and kind of document my battle and my survival because I'm going ahead and claiming it. I want this to be kind of therapeutic for me and also to kind of help other people out there who are going through some type of diagnosis like this or have family members that are going through a diagnosis or what have you. I'm going to give you guys some backstory on my cancer diagnosis. Um, I have been diagnosed with stage 3 lymphoma. Um, it was found basically by accident. I went to my gynecologist for menstrual cramps and issues like that, and she was very thorough. I appreciate her so much. She was very thorough and ordered a whole slew of extra tests that probably would have never been ordered had it been another doctor. And she took care of the whole menstrual situation with my hormones and everything, but she noticed on some of the tests, the scans and things like that, that I had enlarged lymph nodes that shouldn't have been enlarged. So therefore, she was very honest about telling me that, she didn't know exactly what it was and that wasn't her field, but she would find somebody that could tell me more information and look deeper into it. So she found me a doctor in Tallahassee, Florida, and I saw my first doctor, Dr. Kukis, was my GYN in Moultrie, Georgia, and then I saw Dr. Ellison in Tallahassee at Gyno-Oncology, and she was able to do basically look at the scans, and she was still kind of a little confused about what she saw also, and it was kind of a little bit of a mystery for them because mine didn't look the way that they think that cancer should look on the scan. So it was basically, she basically informed me that she would have to go in and do a surgery and see what she could find, basically. And that's scary in itself, to just have somebody tell you, I don't know what it is, but I'm gonna have to open you up to find out what's going on. So when she did surgery, she was able to tell right off that it was cancer. So I'm just kind of documenting, going through everything, and this is me after the calm. This is after I've please by no stretch of the imagination believe that I am just all the way together through this. People who have had any type of cancer diagnosis or going through anything like this right now, don't think that I just woke up and I'm like, oh, I'm gonna take on the world. This is me after breaking down, after crying, after being depressed and not wanting to talk to anybody. This is, now I'm ready to fight this battle. So basically the last couple of weeks, I have gone through, so I had surgery in Tallahassee where she did a biopsy of the lymph nodes, and she did a DNC and all kind of other stuff all in one situation, and it was a laparoscopic surgery, which is better for the healing process and everything, and it's smaller cuts on my stomach or whatever, and now they've completely healed, thank God. I thought it was gonna be a mess. I thought my stomach was gonna look crazy, but she did a good job. It was like a robotic situation, and she was so sweet. She put little hearts on the incisions with the gauze. So that was, I had some very caring doctors and nurses. So, and now last week or the week before last, I have had, so I had that surgery in December. I've had a bone marrow biopsy. I've had, and that, oh gosh, I've had the PET scans and CT scans again, so they can make sure that have a baseline for what they see, and they'll go back and do other scans after I've had treatment just to see what they've killed off. And then I had the port put in, and it's healed. It's a little bit, it was a little bit tight under my skin, but now I guess I've gotten a little bit used to it. It's still kind of funny in there, but I took all the steri strips off yesterday. It's a little bit itchy, but in this port, apparently they're going to have to penetrate it each time to do my chemo. And I'm gonna have 6 months of chemo, aggressive chemo. Hopefully I don't have all of the symptoms that they have mentioned and gone through with the chemo education that they gave me. But so I used to be I'm not gonna say used to be, I am a certified phlebotomist, and I have been I've worked in the hospital and I've worked in doctor's offices, but in the hospital I've gotten most of my experience. And let me just tell y'all, when they said biopsy, bone marrow biopsy, I used to assist with those. I would have to be the lab person in the room to catch the X-ray after the doctor has gotten it, and to look at it and see if it's a good sample and all that good stuff. When they said that, whew, I broke completely down, because I remember my first experience even being in the room for a bone marrow biopsy, and you hear the bone crack, and it's like I almost passed out. It's just a lot. That's a lot. I couldn't imagine at the time myself going through something like that. And I'm not I don't have a weak stomach, but some things I'm just like, whoa, like I don't know if I could deal with that. So when they said bone marrow biopsy, and I've seen this, and they basically have to go through, it's like the iliac crest area, it's like your hip back area. They have to go through there, and it's a long like needle situation. They do like a local anesthesia to numb the skin, but then they got to get to the bone, and there's just like no way you can numb bone. So I mean, they put a little numbing medicine down in there, but you know, they got to get to it first. So, and it wasn't incredibly horrible like I've seen watching it, but it went good. It was not. It was still painful, but they basically have to go down with this tool. It's like a needle hammer situation thing, like not like a hammer, but like a drill sort of situation. It's hard to explain. You can look it up. And they go down into the marrow, and they pull out what's called aspirate and get a good bit of the blood cells and stuff, and then they have to get the actual bone. And that was the part they had a little hard time with mine. He had to go a little bit deeper, and that was, yeah, I'm glad it's over with. But me thinking in my head, like, I've seen these, like, somebody's gonna have to do this to me. Like, I couldn't wrap my head around that. Like, I'm like, are you serious? But thank God, made it through it. Had some great nurses and everything in there too. And the doctor was great. Got through that part, and there is thankfully no cancer in the bone marrow. So that eliminates stage 4. So that's how they knew for sure it's stage 3. Mine is stage 3 because it's above and below the diaphragm. So that's what makes mine a stage 3 and not stage 4, because it's not in my bone marrow. So they want to use aggressive chemo because of my age. They said basically I'm young enough to handle the side effects, and they kind of just want to go ahead and knock it out. Lymphoma is, I think the numbers are like 80-90 percentile curable, so they want to just go ahead and just hammer it with everything we got and cure it. So the side effects that they have told me about basically has been hair loss, or possible hair thinning. I hope that that doesn't happen, but if so, I guess I'm gonna find some more good little wigs here maybe. And I've always had kind of long, thick hair, so I don't know how I'm gonna feel about that, but it's hair and it'll grow back. And please y'all don't tell nobody that. If they tell you that they have a cancer diagnosis, don't let that be the first thing out your mouth that is hair and it'll grow back, because it's a whole emotional issue just thinking about I'm gonna be bald headed in a little while. But now I've gotten to the point in my head of, okay, it'll grow back, we'll be okay. But and I can find some good lace options to play with. So I don't know, I might be a different girl every day. We don't know. But fatigue apparently, and I hope to God, because I hate, if anybody knows me out there, you know, I hate to sit down. I hate not going places. I hate staying at home. I am a goer. I am a doer. I hate staying at home. I hate sitting in one spot. So I hope that I'm not too fatigued going through this process or whatever. And basically the doctor told me when you do get fatigued, the thing that helps it most is to get up and do stuff, because if you lay there, the more you lay there, the more weaker your muscles get, and then it's like a muscle fatigue situation, and you just get even weaker. So it's just like a cycle. So even if I do get fatigued, I'm gonna try to get up and get myself together. So hair loss, muscle fatigue, or just basic fatigue, sick, throwing up kind of situation, and they're gonna give me pain medicine, and I think he said pain medicine, and nausea medicine while they're giving me the chemo, and I have pills already for when I get home. So I don't know, maybe that I hate throwing up. I absolutely hate throwing up. It's so ugh. But hopefully that won't be too bad. And if so, maybe I'll just lose a little weight. Maybe that'd be the plus of it. We'll see. It's a lot of other side effects that he said that hopefully I won't have to deal with too much. I don't know. We'll see. I'm gonna try my best to document all the way through this. I'm gonna try my best. I don't know if dealing with the fatigue, how I feel about documenting or whatever, but I'm gonna try my best to document and get this out there. And anybody going through something similar or have family members that's going through it or whatever, you know, feel free to comment, tell me about your experience, tell all of us, you know. I wasn't going to document this at first, but talking to a couple people and realizing that it's more people than I thought going through these type of diagnoses and everything. Actually last year my mom was diagnosed at the beginning of the year with colorectal cancer, and then I got diagnosed at the end with lymphoma. So me and my mom is kind of holding hands through this situation. So, and hers, thank God, is gone now. She had the surgery a couple days ago to have it completely removed, and she's already gone through the chemo stuff and all of that, and her side effects wasn't so bad. She had the chemo pill. So thank God she's out of the woods with hers right now. So just trying to get over my diagnosis and get through it and see which way we go with this. So like I said, anybody going through this or family members, you got family members out there that have been diagnosed, you know, just comment, tell us about your experience and ask questions. Any medical professionals out there that want to come in and have any advice or anything, just, you know, tell us about your experience and how you can help. You know, I think a lot of people out there are dealing with so many things alone, and the thing is, and I'm very guilty of that, going through a lot and trying to handle it alone. And it's like, you know what, you don't have to be all by yourself. So And really, in the beginning, I didn't want anybody to know I had cancer. I was like, I'm just going to lay up under my covers and cry it out and not go outside and stay to myself. And then I was like, nope, I'm not going to do this. I'm going to battle through this. I'm going to get through this and come out stronger on the other side. Like, I'm not finna do this. I'm not finna curl up in a shell and just go cry to myself. I'm not going to do that. So we are going to handle this like a warrior. We're going to get through this and be stronger in the end. So today, what I have planned, I got a little free day to myself for at least a couple hours. So and I really don't know how to do this. YouTube makes it look so much easier, but I'm gonna try to figure it out. My eyebrows, I cannot do makeup or eyebrows to save my life. I can do a good look, but not eyebrows. So I was thinking, if I end up losing my eyebrow hair, we're gonna have to try to draw these on. So I bought me a kit today. Actually, the other day I bought a kit, and I'm gonna try to learn how to draw them on. And if I get them right, y'all, I'll show y'all. But also, okay. So the doctor said, as far as I do have 2 small children. So as far as them being safe around them, and with the chemo, apparently it can seep through your pores and stuff and come out of your it's gonna go through my all my bodily fluids, saliva, urine, all that kind of stuff. So they're actually gonna have to end up using their own bathroom in the hallway and stay out of my bathroom. And I can't let them drink behind me, which is gross anyway. I don't do that. But as far as I'm using the same silverware and stuff, so kind of to eliminate any kind of cross contamination, what I'm going to do today is go and get some plastic silverware and plastic cups and stuff for me, just to make sure I don't end up giving them any kind of cross contamination with the cancer medication or anything like that. And they already know. I do have small kids, but I try to stay very honest with them, and they understand a lot. So they already know my diagnosis, and I explain it to them that they're gonna have to have these precautions and everything, and they get it. They understand. So we're just gonna try to keep all of the contamination and all of that stuff down from getting to them. So I got to go out and do that today. What else do I have to do? I start chemo tomorrow, which is scary when I think about them puncturing this thing with a needle. I really want the little outside situation where they just hook the IV up to it, but apparently this keeps down infections, but I don't know about this. But we in here now. We just got to keep going. So that's a little scary. And then I have all my medications that I have to take. One of them I have to start today, the day before I get the actual chemo. And then the other ones I take during the next couple days of the chemo situation. But the chemo apparently is going to last, the first session, 3 to 4 hours, because they run it slowly. And then they said the next ones will just probably be like 3 hours or so. So, and then I'm going to have a chemo session basically every 3 weeks for the next 6 months. So, and he told me probably on the 3rd day after the chemo is when I'll probably feel the weakest. So we'll see. Hopefully I won't, but we'll see. Maybe I don't know, maybe I'll drink like an Ensure or a Boost or something. We'll just see how the first one feels, and we'll go from there. And he said any side effects or anything that I feel, to make sure that I let them know so that they can kind of counteract that and document like what's going on with it and everything. So I think that's about it for my first vlog. Y'all, maybe I'll get better at this. Maybe I'll learn how to edit this stuff right and all of that. I don't know. We'll see. We'll see how far we get on this. And y'all just comment and tell me what y'all think, and if y'all found some good wigs and good hairstyles and chemo caps. Oh, I did find some stuff on Amazon. I wanted to do the whole little India Irie little bun kind of situation with the wraps and all of that. I found some of them that are already wrapped up. If anybody is looking for anything like that, they have them on Amazon for a good price. So I think I'm gonna order those, but I don't know, it just depends, because hey, maybe I won't lose my hair, I don't know. But for the people who are already going through hair loss or thinning or anything like that, they do have things like that on Amazon. And maybe I'll find a good lace front situation. We'll see. We'll see. Okay, y'all, thank y'all for watching. I'm gonna try to keep this channel updated as much as possible. I'll try to record before and after my chemo session tomorrow. I don't think I can record in there, but we'll try to record before and after and see, and I'll tell y'all how it was and how I felt. We'll go through that. All right, thank y'all for watching.